this is a study looking at continuing versus discontinuing statin medications in people with advanced illness, and specifically with an anticipated year to live or so. Fundamentally, we know that the number of medicines in the pill cup doubles in the last year of life. People get more medicines to treat their disease, they get more medicine to treat side effects and symptoms, and then they're also on medicines for their comorbidities, things like their high blood pressure and their lipids. And the problem becomes how to make decisions about which medicines can be discontinued or stopped. How do you simplify the regimen? One of the common medicines people are on, about 25% of Medicare beneficiaries, are statin medications. These are medicines usually prescribed to lower lipids and to reduce the chance of developing heart disease and stroke. The fundamental question was, among people who have advanced illness and a life expectancy of a year or less, is it safe to discontinue statin medicines? And if statins are discontinued, what are the other potential benefits like quality of life? This was a pragmatic, randomized controlled trial looking at statin continuation versus discontinuation. There were 381 patients randomized. Of those, about half had cancer, and overall, the people in the study lived on average about 9 months. When we look at the results of the study, what we found is that discontinuing statins did not cause any overall change in survival, and the primary outcome, which was 60-day mortality, was not statistically different between the two groups, and overall survival was not statistically different between the two groups. When we look at the key secondary outcomes, there was some interesting findings. When statins are discontinued, patients reported improved quality of life, and this was statistically and clinically significant. There was also a trend towards fewer symptoms. There was a trend towards improved satisfaction with care, and there was statistically significant fewer other medicines than statins in the group had their statins discontinued. So other medicines were getting discontinued as well. And you can imagine that there was a cost analysis that went along with this. And although that was not the primary goal, certainly when medicines are being discontinued, there is a positive benefit in terms of improving costs.